Hi, so just back to give you information on where we are as a city with COVID and all that's happening in the city to keep us as safe as possible. So over the last 2 weeks, we've actually seen a gradual decrease in our case numbers. This is good news, but it's also something that we expected as a result of the lockdown. And it does show that lockdowns, as unpleasant as they are, do actually work. So as of yesterday, Bristol's infection rate was 332 new cases per 100,000 people. And this is only just below the England rate of 387 cases per 100,000 people, but shows that in terms of recovery, we're doing okay. I think our rates are not dropping as fast as other areas, but they are dropping. But we do need to continue to do all we can to drive those numbers down. We are all still at risk, and we cannot afford to get complacent. In our hospitals, case numbers are dropping as well, but the health services themselves remain under huge pressure. So again, as of the 27th of January, there are 425 cases, patients severely unwell with COVID-19 in hospital beds across the region. So the best thing we can do to support the NHS and each other, remember this, is to avoid mixing socially with people not in your household. Keep washing your hands, wearing a face mask, face covering, keep 2 meters apart, stay at home. Remember the principles of transmission. It's person to person through droplets, aerosols, and contact with shared surfaces as well. Our health services are here to support you, to help you, but please help them by using them appropriately. This means using NHS 111 first before visiting A&E, unless it's a serious or life-threatening injury. Now, throughout this pandemic, NHS staff have been there providing urgent and appropriate care, and along with critical workers across Bristol, they've witnessed firsthand the impact this virus is having. Now, on the vaccine front, the rollout across Bristol is continuing. The NHS are really driving this, for us and for the wider region. Now, it's really important that priority groups are vaccinated quickly. So can we ask you to please be patient if you are not in one of these priority groups? Your turn will come. It's important that people attend vaccination appointments when they are invited to make sure we're making best use of the time and resource. Your GP practice will contact you by letter, phone call, or text message. They will invite you to be vaccinated at your local GP vaccination site. When you do get invited, get yourself booked in as soon as possible. But look for the contact coming from your GP. Please be aware of messages that ask you to make a payment for your vaccine. Nobody will be charged to receive a COVID vaccine when invited to receive one. So unfortunately, there have been some opportunists, some scammers going around. Do not give out your payment details. Be aware of that yourself, and please make people in your circle also aware that they should not be giving out any payment details. It's for free. Look out for the contact from your GP. Now, we know there are some questions and concerns about the vaccine, and there has been some hesitance towards getting vaccinated. Just to say, it is the most important thing we can do to protect ourselves and our communities against ill health. The vaccines approved for use in the UK all meet strict standards of safety, quality, and effectiveness. And these are set out by the Independent Medicines and Healthcare Products Regulatory Agency. So look them up, MHRA. Any coronavirus vaccine that is approved must go through all the clinical trials and safety checks all other licensed medicines go through. So we need to build trust and confidence in a vaccine that could help to save lives, yours and that of your loved ones. I want to just say something about supermarkets, because they've been part of the essential infrastructure helping us to get through this pandemic. We've really grown to appreciate our retail workers. Supermarkets have taken considerable steps so they can operate as safely as possible. And we're really grateful to all of those workers in the supermarkets and the supply chain for keeping us fed. We can all help minimize the spread of COVID-19 even further by following these simple steps when you are shopping and thinking about shopping. If you can, please arrange a click and collect or delivery service. Make a list before you go. This will help reduce the amount of time you spend in the store wandering around and keep your visits as short as possible. If you can, shop alone to reduce the numbers of people in the shops. If you can, avoid shopping at busy times. Wear a face covering unless you're exempt at all times in the shop, and it must cover your nose and your mouth. Sanitize your trolley or basket before using them. Sanitize your hands when you enter and when you leave the store, and keep your distance from others so we can shop safely, as safely as possible as well. And on schools, the Prime Minister has just announced that schools will not start to fully reopen until March at the earliest. We understand this is going to be met with a real mixed response, a real challenge for families right across the city. So throughout the pandemic, we've maintained and stayed with our belief that school is the best place for children. They're also the best placed organisations to decide if they can open safely. But we really recognise the public health need and consequences that school closures will have on families and schools. So we know the past weeks and months haven't been easy. Parents have been juggling work and homeschooling. I've been involved in that with my wife too. Teachers and school staff are supporting those homeschooling and those vulnerable children and children of key workers currently attending school. I know it's a lot of work for teachers as well, managing homeschooling. This is going to be a challenge. Our continual press to government is to be making sure that they are putting the resources in place to support children and families, both with the equipment, the laptops, and with the access to the internet. We are starting our own scheme in Bristol again as well about digital inclusion for children and older young people, young adults, and adults of working age as well. So we're really trying to make sure that we offer the wraparound support for these closures. If you have any challenges and you need support, the We Are Bristol free helpline is there. Call us on 0800 694 0184. This is the time in which lots of people have needs. People feel down. You need to reach out to us if you need that support. Don't feel that this is anything to be embarrassed of or ashamed of. It can be anything from your own feelings, a sense of isolation, access to food, medicines. That helpline, 0800 694 0184, is open Monday to Friday, 8:30 to 5 p.m. and Saturdays and Sundays from 10 till 2. So it's a free phone number for you. All right, take care, stay safe, and look after each other out there.